Hello, my name is Deborah. I am originally from Trinidad, but now I live in South Carolina, and we are actually expecting some bad weather. I've been a nurse for about 12 years. The majority of those years were in telemetry nursing, and somewhere in there I dabbled in a little bit of mental health nursing on the floors. My hobbies are traveling, movies, reading, and family cookouts. I like spending time with friends. Like every 3 months or so, my friends and I we get together and we have dinner and we catch up. Something about my family. My family is very small. They are my anchors, and I literally feel like when I do better, they do better, and it's because my family is small, very small. My other members of my family they're in Trinidad. Um, why am I interested in psychiatric nursing? I am interested because mental health is pretty. It's definitely in my family, and another aspect of it that I started noticing at the bedside is that there more and more mental health patients were coming to the bedside, or maybe their mental health was becoming more obvious to me. I know it was a direct effect of some of the local mental health organizations closing due to lack of funding. But I remember noticing that sometimes these patients would come in, and even my coworkers weren't always very sensitive to some of their mental issues. They would be quick to say, and these are nurses, seasoned nurses, who would be quick to say, "Oh, he's just acting," or "He's just stubborn." And I remember thinking, wait, something isn't quite right. Take a second look. So I personally started noticing that I feel as though more mental health patients were showing up at the bedside, and quite possibly we needed to move away from the bedside and kind of look at the whole scope. I mean, mental health is real. Um, my corregals. I personally would love. I really look forward to a mental health fellowship. Locally, I should say nationally, and even possibly abroad. I think that would definitely be a highlight for me because it's the perfect way to learn doing a fellowship. And I think it would definitely strengthen me as a nurse, mental health nurse practitioner. Um, as for my course expectations, so far school has been more of a burden for me than a form of excitement. I think I was probably definitely schooled out, definitely worked out. But I have to say, until I registered for these two classes, which is advanced psychopharmacology as well as psychotherapies, I actually started feeling some stirs of excitement. So for me, I have the excitement. I was also a bit concerned about the workload, trying to balance family, work, and just mental health overall. But the mere fact that I started feeling stirs of excitement, it was a really good thing for me. And I think it's because these two classes are really going to truly show me or per se guide me. These are actually based into my chosen field. So I really look forward to learning and just absorbing everything it has to offer and then some. I want to be highly skilled and I want to be highly knowledgeable in my field. So this nervousness, this excitement, I feel is really good, and it's a sign for me that I'm going in the right direction. And one thing that you may not know about me, I truly try to give people the benefit of the doubt. I tend to stop and weigh. So, and I think it's somehow it seems that people always assume. I think sometimes people should have more conversation. I think if you hear what someone has to say, depending on what the situation is, kind of give people the benefit of the doubt first until they prove otherwise. I think that's important. I think it's humanistic. I'm not saying you can use that in every aspect, but I think it's worth it. I think people usually are people first before they're monsters. So that's it. Nice to meet you.